Hi everyone, I'm Abigail Solomons from Positive Trust based in Windhoek, Namibia. I am deeply honored to be part of the international workshop on HIV and adolescence, especially this conversation around active youth participation in research. What does this look like? What does this mean? Why is this important? Positive Trust is an organization that works primarily in Africa to end othering, the othering of marginalized, vulnerable, and often criminalized groups, including adolescent girls and young women, LGBT persons, sex workers, and other marginalized communities. Our work is centered around core beliefs. One of these beliefs is that human beings have inherent dignity and worth. That informs our second belief, that is that people, especially those that experience chronic, acute exclusion and marginalization, must be the subject of their own response, not simply the objects and targets of interventions by others. Thirdly, that rights and health are indivisible. When rights, including the right to participation, are sidelined, even with the best of intentions, health outcomes suffer. This requires authentic participation, the recognition, the acknowledgement of disparities in power, the access to information, choice, decision-making, and negotiation to resolve these imbalances that perpetuate inequity and reduce dignity. A core belief that is especially important for this conversation is community-led research and monitoring that informs accountability. These are strategies to mitigate civic, social, political, economic, and structural inequality and injustice, increase individual confidence and agency, and amplify voice and dignity. We live in a world where we are increasingly prompted for feedback, to make assessments and offer judgments about all kinds of subject matter, both profound and mundane. Trucks on highways display bumper stickers asking, "How's my driving?" Restaurant managers pass by our tables, "How's your meal?" Conference and workshop organizers distribute evaluation forms at the end of most meetings to ask, "Have we done a good job?" In our modern age, most industries have realized an important truth: feedback matters. So when we look at health services, if healthcare were a product, a commodity, surely consumers might expect to have some say in the quality of the product. However, we have created an unhelpful and artificial distinction between the health system, populated by technicians and clinicians and professionals who provide these services, and then community systems populated by individuals, households, families, neighbors who interact socially and relationally to support and promote healthy behaviors. This includes our youth. Perhaps citizens and communities have come to see themselves only as receivers of services supplied by public health providers, rather than the stakeholders whose participation in an integrated system for health is required to ensure that services are effective and both relevant and responsive to the lived experience of people in community, especially our youth. As recently as the World AIDS Conference in July 2020, leading global institutions, including the International AIDS Society, PEPFAR, the Global Fund, and UNAIDS, have affirmed the role of communities in strengthening health systems and programs, the growing emphasis on social determinants of health and health-promoting behavior, and the emergent priority of community-led monitoring of health facilities and services. This is an important signal of future policy, practice, and priority across countries around the world. But what does youth-led research look like? It means that research needs, questions, priorities are defined by youth. That youth takes part in the development of protocol and inform the development of methodologies. That youth take part in the implementation of the research activity either through community mobilization, data collection, and analysis. That community members, including youth, lead the monitoring of progress, including the tracking of application of ethical procedures, either through the establishment of a community research board and frequently engaging with community members. That youth verifies and validates data, and that youth leads in the dissemination of data and packaging of data to best serve the application of findings and lessons learned. But why is youth-led participation so important? We are more than numbers or targets. To ensure that no harm is done, youth wants and need to be respected in their personhood. Participatory research allows youth to understand, inform, and actively participate in research activities. By engaging from the onset with the relevant stakeholders, we ensure that the youth are no longer objects of research, but active players. They understand why the research is important, why it's being done. Their expertise informs the development of protocol and tools. More importantly, they understand what findings will be used for and how lessons learned will be applied. Youth-led ownership and leadership in research is especially important to create trust within community. Only when leading, when involved and consulted, will youth share deeply personal stories that often provide us with clues to underlying factors impeding equitable healthcare. The story below was shared during one of our community interventions and led by community youth activists that looks at the struggles that young women face in this particular region. So elongation of the labia minora. When I was 8 years old, I was instructed by my grandmother to start to pull and stretch my labia. I did not know that this was to provide for the sexual pleasure of my future husband. I was just told I would not get a husband if I don't have a long labia. Girls' genitals are regularly inspected to see whether they are pulling their labia correctly, and girls are evaluated by the length of their labia. Before a wedding night, a woman may be inspected, and if she does not have a long labia, she may be sent back to her grandmother for further training. This deeply personal story would not have been shared with a stranger, with an outsider. And for many of our processes, we need to establish trust within our communities. The only way to establish trust is when people within the community lead on these processes and understand why these processes are taking place. A very important consideration is to ensure that data is representative of diversity within youth-focused studies. Unless the purpose of the study is specifically designed to explore the vulnerabilities, needs, and context of subcommunities, many studies revert to heteronormative, cisgender assumptions relating to youth demographics. For example, LBQ women and trans men data is often subsumed within data sets that make heteronormative assumptions what constitutes womanhood. Assumptions on the types of sex women have, the types of reproductive and sexual needs women have, the types of relationships engaged in, which in turn influence the types of questions we ask. These assumptions, the findings, the lessons learned, then translate into policy and practice. To ensure that youth-related health policy, law, and practice is nuanced, youth participation, diverse youth participation, is key. Country and regional policy, unless specifically designed to cater for specific subpopulations, are often heteronormative and assumes a homogeneity amongst youth groups. Policies and strategies that integrate, for instance, gender considerations almost always assumes girls and young women, boys and young men who are cisgender and heterosexual. Sexual and gender diversity is not considered. This lack of acknowledgement fuels then the never-ending cycle of limited national budgeting for diverse youth, lack of focused and nuanced interventions, procurement of SRH and related commodities, and the development of specific nuanced communication materials. Youth participation, diverse youth participation, ownership and leadership within research ensures equitable youth-focused health solutions. Health services to youth requires these equitable solutions so that they are fair, accessible, appropriate to and adjusting for, compensating for and making provision for diversity so that no one is included from good health because of their diversity. Equity requires that youth are treated in attitude and regard and literally in medical treatment, as if each person is equally deserving of the highest standard of health, suited to their unique needs and right fit for gender and for sexual orientation, and within the easy reach of young people who often face many barriers, social, economic, class, physical, legal, and environmental, to accessing services. I'd like to end this address with words from Namibian Ombudsman, Advocate John Walters, who said, "The opposite of exclusion is not inclusion, it's justice." Youth-led participation in research is essential to ensure appropriate, nuanced, and owned research design and process. Youth ownership and leadership in research leads to the application of lessons to strengthen youth-focused policy, law, and practice. We look forward to the continuing of this conversation with other presentations, and with these words, I thank you.